Welcome to Dr. Dean's special bonus video titled Injecting Reality into the COVID-19 Mass Hysteria. In addition to calling this a viral pandemic, the other word that applies is surreal. The inmates have taken over the asylum, the bizarre has become accepted wisdom, and surreal is now real. Let me inject some realism into our current nightmare. Yesterday, I received an email with a tagline, "Coronavirus worse than Ebola, a virus that kills 90% of all people, including the healthy." The sellers of discs claimed that the current infection rate was 83% and the mortality was 15%. They claimed this was the worst disaster since the bubonic plague that killed 1/3 of the population of Europe back in the Middle Ages. The real infection rate is 0.04%. The fatality, as in mortality rate, is 1.7%, and even that number is an exaggeration. Things are likely to be much better, and here's why. The number of confirmed infected Americans is 143,358 so far. Since testing is limited to only those who are symptomatic, no one knows how many Americans are infected but not sick. Being infected is not what matters. Being sick, especially if you have a pre-existing condition, is the only cause for concern. Right now, you, me, and everyone else on Earth have a number of viruses living in your mouth. As long as the viruses don't make you sick, you don't care. Since COVID-19 is quite contagious, there are probably millions of Americans who are infected and healthy. And as the number of asymptomatic infected persons goes up, the risk, to health goes down. Thus, the danger of becoming seriously ill is much lower than advertised. And the same logic applies to the death rate. 2,486 Americans have died with COVID virus as of March 30th, 2020. To calculate the death rate, you divide the number of deaths by a population, such as all Americans or those with confirmed infection, called case fatality rate or CFR, or those who are debilitated with a serious pre-existing condition, such as diabetes or heart disease. The 1.7% death rate I mentioned earlier was for proven infected persons, most of whom were elderly, seriously ill patients. In fact, the first 19 deaths were all in a nursing home. As a pathologist, I have been involved in hundreds of autopsies. I can assure you that even with a post-mortem exam, it can be very difficult to determine whether someone died merely with a condition or because of that condition. So, when an 85-year-old diabetic in a nursing home dies who has kidney failure, heart disease, chronic lung disease, and coronavirus, what caused that death? The lung problem, the heart problem, the kidney problem, the virus, or a combination thereof? The key takeaway is that the risk to healthy Americans, regardless of age, is very, very low. And oh, by the way, the first documented U.S. case from January 22nd, 2020, a healthy man in his 30s, has now since fully recovered. Next reality. Is the shortage of face masks real? Not in South Korea. They were prepared. They had a stockpile ready to deploy. The U.S. also had a stockpile of more than 100 million masks and used them for the H1N1 epidemic in 2019. The problem is that Washington didn't replenish the emergency stockpile. So when COVID-19 virus hit, we had no masks, particularly for the healthcare workers who are at greatest risk of contagion. The shortage of hospital beds, especially ICU beds and ventilators, creates not just a medical problem, but a moral dilemma as well. With more patients needing hospital beds than beds are available, triage is necessary. Someone must decide who gets care and who doesn't. That is a medical problem. The moral dilemma is who should do the triage, the patient's doctor or the state. And you can guess how strongly I feel about this. The only person who should make medical decisions, especially for triage, is the doctor on the scene. That physician should be allowed to use his or her best judgment for the patients before them and not be required to obey government advisories or guidelines that turn out invariably to be mandates, not advice and not guidance. Now, how's about some perspective on the true danger of COVID-19? In 2017, 70,237 Americans died from opioids. In 2019, there were more than 40,000 traffic fatalities and 39,773 Americans were victims of gun violence. Last year's flu season killed 61,200 Americans, and so far, 2,486 have died with COVID virus. As few have had autopsies, we cannot determine whether they died with or because of the virus. One more reality check. COVID-19 has swamped our healthcare system. People with kidney disease or heart problems can't get medical attention. How many of these non-infected but seriously sick Americans died needlessly because of lack of timely care? I fear that number could be higher than those who died because of COVID-19. There are important lessons to learn from this experience. Number one, being infected does not mean that you're sick. We need to pay more attention to the number of Americans who died because of COVID-19 than those who are merely infected. Number two, doctors, not bureaucrats, should be making our life and death decisions. Number three, debilitated patients, the ones who are sick, are at greatest risk of illness and death with this virus. So the best protection against it is being in good health. Don't smoke, do exercise, and eat healthy. Number four, to prepare for the inevitable next outbreak, we need to play medical as well as financial war games. We can respond better and more quickly if we have a fully developed contingency plan and stockpiles. Finally, number five, we have to learn that remote actually works for education, for work itself, for shopping, and most definitely for telemedicine. For more on healthcare in general, and specifically how to get affordable, accessible health care, read Curing the Cancer in U.S. Healthcare, States Care, and Market-Based Medicine. If you have not already subscribed to this website, We Can Fix Healthcare, check it out at deanwaldman.com. That's Dean with an E. My mother did that to me 76 years ago, and I've been paying for it ever since. Just click on the blinking icon at the top right. There is no charge for any of this bonus material. Encourage your friends and neighbors to subscribe as well. Finally, please be sure to subscribe to my YouTube channel to view the latest videos. Just click on the image to your right. Thank you for watching and for being a part of the cure for our sick healthcare system.